Hi, welcome back. So in this lecture, we'll focus on symptom recognition and interpretation of symptoms and health information and misinformation. So utilizing health services depends upon how and whether people recognize and interpret their symptoms. So although people have some awareness of what's going on in their body, that awareness is often limited. And this limitation leaves a great deal of room for social and psychological factors to operate in the recognition and interpretation of illness. These experiences of symptoms can vary from person to person, so they're not always the same. So, for example, if somebody experiences pain, their feelings of how severe it is are going to be different from the next person, and their own feelings of pain. Not everyone experiences the same severity, and so not experiencing the same thing could lead to differences in recognizing symptoms, interpreting them, and seeking out healthcare services. And so the experience and interpretation of symptoms includes a heavily psychological process. Individual differences can include hypochondriasis or somatic anxiety. So normal bodily symptoms that are experienced are often mistaken for indicators of illness. So people that experience hypochondriasis believe that they're sick in some way every time they have a symptom or they have physical sensations. Also, the individuals high on neuroticism can exaggerate their symptoms and are often more attentive to their symptoms compared to those low on neuroticism. And so the most frequent symptoms experienced by people who convert their distress into physical symptoms are oftentimes their back pain, joint pain, pain in the extremities, headaches, abdominal symptoms such as bloating, allergies to certain foods, and heart symptoms such as heart palpitations. There's also found to be attentional differences. So research has shown that people who are often very focused on themselves are quicker to recognize symptoms, whereas people with more distractions and who attend less to themselves experience fewer symptoms. Situational factors, stress, mood, and emotions can all impact the recognition and interpretation of symptoms. For example, boring situations tends to make people more attentive to their symptoms than engaging situations or activities that require attention and cognitive effort. Also, situations that tend to make illness more salient promote more attention to symptoms. So medical students' disease is a condition often reported in medical students who perceive themselves to be experiencing the symptoms of a disease that they're studying. Stress can also exacerbate the experience of symptoms because people under high stress tend to believe they are vulnerable to illness. Negative moods and perceptions can make people feel more susceptible to getting sick. And so if they feel sick or if they feel ill, they're more likely to attribute stress and negative moods to their sickness. The interpretation of symptoms are often determined by prior experience, expectations about sensations, and the seriousness of the person's symptoms. So common disorders are often regarded as less serious compared to rare disorders. So people that have common disorders and then prior experience with them are less likely to take them seriously and feel more confident in managing them. Unexpected symptoms are ignored and expected symptoms are often amplified. And so expectations can influence the interpretation of symptoms. So a lot of times people may ignore symptoms that they're not expecting to have and then exaggerate the symptoms that they are expecting. When people feel vulnerable to disease, they're more likely to interpret bodily sensations as indicative of illness and regard other people in the environment as potential disease carriers. The seriousness of the symptoms also affect the interpretation of symptoms. People are more likely to take a symptom seriously and seek treatment if the symptom affects a highly valued body part or causes pain or limits their mobility. And so, for example, people are anxious when their eyes or their face are affected, but they're less likely to be anxious if their symptom involves part of the trunk. So previous research has extensively used subjective utility models such as the health belief model and the theory of planned behavior to understand health behaviors and bad habits. And these models typically treat the individual as a rational decision maker who weighs positive and negative attitudes and beliefs regarding their desired behavior and ultimately their behavioral decisions. But these models fail to capture the cognitive and emotional processes by which an individual interprets and responds to health threats. And so Levental's common sense model of illness is a self-regulation type of model. It provides a theoretical framework for examining the influence of illness representations, which is how people think and feel about their illness and how it affects their behavior and their physical and psychological outcomes. And so people hold these common sense beliefs about their symptoms and their illness. And these are organized into illness representations. And these illness representations include basic information about an illness. So whenever somebody experiences a symptom, people often try to identify the cause of the illness, the name of the illness. They often try to think about the consequences. So what effects will this have on my quality of life? They'll also, come up with a timeline for how long this illness might be expected to last. Can this illness be managed or cured through appropriate actions and treatment? So people often try to seek the cure, or how do I treat this illness? And then there's emotional representation. So people have feelings and emotions about what they're experiencing. And then lastly, coherence is the extent to which these beliefs represent the disorder. And so all of this basic information about an illness is represented cognitively, which is known as these common sense beliefs, and can affect how people perceive, interpret, and recognize their symptoms and what they do about it. Most people have at least 3 conceptualizations of illness, which are acute illnesses, chronic illnesses, and cyclic illnesses. Acute illnesses are believed to be caused by a specific viral or bacterial agent and is short in duration. This illness typically has no long-term consequences. So for example would be the flu. Then there's chronic illness. These illnesses are believed to be caused by multiple factors, including health habits, health behaviors, and they're typically long in duration, and they often come with severe consequences and affect quality of life. So an example would be heart disease. And then there's the cyclic illness, marked by alternative periods during which there are either no symptoms or a lot of symptoms. So an example would be herpes or some type of sexually transmitted infection. And so people's conceptions of illness vary, and they can greatly influence behavior related to the disease. So diabetes, for instance, may be regarded by one person as an acute condition that's caused by diet that's high in sugar, whereas another person with the same disease may see it as a lifelong condition with catastrophic consequences. And so when you have different beliefs about what's causing your condition and how serious it is, oftentimes this leads to different types of ways in which we respond. So these people will treat the disorders differently and maintain different levels of vigilance towards symptoms. So a lay referral network is an informal network of family and friends who offer their own interpretations of symptoms well before any medical treatment is sought. So the patient may mention symptoms to the family member or their friends or coworker, and if that person has experience, they may respond with opinionated views of what the symptoms are likely to mean. And so they may offer advice about what to do and the advisability of seeking medical treatment and the recommendations for home remedies. And so advice is typically offered in terms of like what to do next. And in many communities, the lay referral network is a preferred mode of treatment. And so a powerful lay figure, such as an older woman who has a lot of children, may be very credible to a patient because they act as a lay practitioner based on their years of medical experience. And so they're assumed to have knowledge and answers and personal wisdom in medical matters. Within ethnic places and communities, the lay referral network will sometimes incorporate beliefs about the causes and cures of a disease that would be regarded as supernatural or superstitious by traditional medicine. The internet is a lay referral network of its own, so the amount of health information now we find on the internet has risen exponentially in recent years. So as a result of that, a lot of people now can investigate their own and their other family members' symptoms and disorders online well before they seek medical treatment. And estimates are that at least 80% of internet users have searched a health-related topic on the internet. 2/3 of internet users have used it to find health information, and many physicians depend on the internet for the most up-to-date information on illnesses and treatments. So a lot of the latest research is on the internet, and you can find that on Google Scholar. You can find it at online libraries, PubMed, or any of the research sites now. Although the internet is a great source for obtaining health information and knowledge, and many physicians turn to the internet themselves for the most up-to-date information on illnesses and treatments, and as well as the processing of insurance claims. Some of what is on the internet is not accurate, and it has affected numerous health-related behaviors and decisions that people make for themselves. And in fact, people that often rely on the web to get information without seeking healthcare oftentimes get worse. And it's because the information that they're obtaining is not accurate and it's not backed up by research. So some examples are individuals refusing to get their kids vaccinated or only sticking to organic products and avoiding genetically modified foods, or avoiding products that contain fluoride, even though there is a lot of research for fluoride and vaccinations that result in positive outcomes. And so there's this misinformation spread on the internet, and a lot of these trends, with the internet being the most widely used source of health information, can be worrisome. But telemedicine, which are virtual visits with a physician, has increased substantially. And that has actually been a good way to get people into the doctor's office and seek health services. And so the internet is a lay referral network. It does have inaccurate information, but it also does result in positive outcomes and can help a lot of people. And so it's important to look for misinformation when you have more knowledge about your own health and your behaviors. So people look to social media not only to obtain information, but people use social media to broadcast health information. And so one study analyzed 87 YouTube videos during an 8-year span on vaccine safety. And they were interested in looking at some of the sources, like where was this information coming from and who was presenting the information. They found that the 3 most common sources were consumers, TV-based or internet-based news, and individual health professionals. They found that about 65% of videos had anti-vaccine related content. About 25% were pro-vaccine, and about 10% were at a neutral stance. And so there were different opinions regarding vaccine safety. And the number of views on pro-vaccine and anti-vaccine videos were nearly equal. They also found that out of the anti-vaccine videos, the most common reasons discussed were autism causality and signs and symptoms of adverse reactions to vaccines, or some very dangerous hazardous agents in vaccines. And then they also found that over 1/3 of these videos that were against vaccines presented no scientific evidence to support their stance. So these were based on just opinionated views and overall just based on experience and talking to others. So there's a basic law of rumor, which is the amount of rumor that's in circulation about the topic in question. And this will vary based on its importance to the individual and the ambiguity of evidence pertaining to that topic. And so the rumoring behavior during crisis events tends to be a reaction to information scarcity and ambiguity. So when information is uncertain and people, there's not a lot of evidence for or against that behavior or information, people make attempts to fill in the gaps by trying to create their own story or their own versions of truth that fit with their existing beliefs and attitudes. And so self-correcting is hard to achieve once you're exposed to misinformation. Susceptibility to health misinformation depends on several factors. That includes confirmation bias, neglecting misinformation corrections, and how much health organizations communicate to the public about health misinformation. So people have tendencies to reject content that contradicts their attitudes and share content that's consistent with their own narratives. So that can result in more susceptibility to health information and misinformation spread. People also allow false information to continue to affect their conclusions, even when they bluntly admit the information is incorrect. So the more that people allow this false information to continue to affect their beliefs, the less likely they're going to change their beliefs and the more susceptible they are to the health misinformation. And then, ineffective dialogue with the public can also create more susceptibility. So if there's a lot of ambiguity surrounding the illness or information, people, can become very uncertain about what to do. And so they tend to then create their own versions. And therefore, this can be even more worrisome for the internet because people then have a tendency to post online something that might not be true. And so it's important for health organizations to communicate effectively with the public so that way we can reduce susceptibility to misinformation spread. In emergency and crisis situations, people often seek information to reduce their uncertainty about a situation. In order to be able to make decisions, people need accurate information that will enable them to assess the risks and the benefits involved. During epidemic outbreaks, health organizations are required to respond and correct information to gain the public's trust and influence it to follow the recommended instructions on staying healthy. Currently, there's very little empirical research on how health organizations should react and correct misinformation. Overall, the implications of studies regarding health misinformation show that widely viewed misinformation may contribute to a reduced recommended health practice and increased risk of preventable diseases. So healthcare professionals should be aware of the widely disseminated misinformation on the internet and its negative effect on the public. Research has also shown that misinformation correction techniques are often most effective when they address the public's emotional concerns and responses to a health crisis. The issue of how to implement effective activities to correct misinformation on social media is at the center of the discussion in the literature.